This is a story about Mathew Torres. He is a 6-year-old kid who was diagnosed with leukemia. His mom, Sandra Torres, was devastated since the bad news was given during the Christmas break in December 16th, 2010. They have gone through a lot since they've learned about this situation with Mathew, but what's good to know is that Mathew is receiving a very good treatment and he's gonna make it. For people that doesn't know what leukemia is a malignant progressive disease in which the bone marrow and other blood-forming organs produce an increased number of immature or abnormal leukocytes. They suppress the production of normal blood cells, leading to anemia and other symptoms. What are the types of leukemia? The types of leukemia can be grouped based on how quickly the disease develops and gets worse. Leukemia is either chronic, which early in the disease, the leukemia cells can still do some of the work of normal white blood cells. Doctors often find chronic leukemia during a routine checkup before there are any symptoms. Or also the acute leukemia, which the leukemia cells can do any of the work of normal white blood cells. The number of leukemia cells increase rapidly. Acute leukemia usually worsens quickly. There are 4 common types of leukemia: the chronic lymphocytic leukemia, or CLL, the chronic myeloid leukemia, or CML, the acute lymphocytic or lymphoblastic leukemia, ALL, or the acute myeloid leukemia. Mathew has ALL, acute lymphocytic lymphoblastic leukemia.
I'm Jim Nachman. I'm a professor of pediatrics at Comer Children's Hospital. I'm the director of the Leukemia Lymphoma Program for adolescents and young adults. I came to the university in 1978, and I've been here ever since. In children, we generally see acute leukemias, and the 2 most common types we see are ALL, or acute lymphoblastic leukemia, which accounts for about 80% of the cases, and acute myeloid leukemia, which accounts for the other 20%. There are rare chronic leukemias, which were much more common in adults, that we occasionally see in children as well. So in general, kids with lymphoid leukemia or lymphoblastic leukemia present with fever because they don't have enough white cells, so they become infected. They present with pallor or pale skin color because they don't have enough hemoglobin, they're not making hemoglobin. And they present with bruising because they're not making enough platelets, which are little things that stop the skin from bleeding when you cut yourself. They may also have big lymph nodes in the neck. They may have a enlarged liver and spleen. They sometimes present with significant bone pain because the bone marrow expands because of the cancer population of cells. Lymphoid leukemia is diagnosed in a number of ways. You can diagnose it on a peripheral blood smear if you see blasts or tumor cells. We then would take that blood specimen and look at it by a technique known as flow cytometry to determine whether the cells are lymphoid or non-lymphoid. In certain cases where there are no blasts circulating in the blood, we do a bone marrow test where we can also detect malignant cells. So it's a combination usually of peripheral blood evaluation and a bone marrow evaluation. Once a child is diagnosed with leukemia, they are generally hospitalized for the initial diagnosis and management. Usually we can get kids out of the hospital within about a week, some as early as 3 to 5 days. The vast majority of our treatments for childhood leukemia, lymphoblastic leukemia, are outpatient based, so they have to spend very little time actually in the hospital. Once they go into remission, which means that the cancer is no longer detectable through routine blood counts or bone marrow examinations, they generally are back in school and doing well. I have kids who play sports while they take chemotherapy. I have kids who play sports while they have ports or lines in place. So really, once we get through the first month or so, there's often minimal disruption of their lifestyle. The treatment of lymphoid leukemia has changed dramatically over the years. We've discovered that more aggressive chemotherapy produces better outcome than less aggressive chemotherapy. We found that mixing various types of chemotherapy in different fashions creates a better outcome. We have occasionally introduced new drugs such as asparaginase and other drugs into the treatment. But the general principles have remained the same for 50 years. It's just that we've been able to develop much more useful guidelines for how to give chemotherapy.
Mathew. Por favor,